Good day, everyone. My name is Sister Kave. Today, I want us to cover sexually transmitted infections. STIs, they are called, or STDs. STI is actually sexually transmitted infection. STI. STD means sexually transmitted disease. What are they? What are STIs? STIs are all the infections or the diseases that you get through sexual intercourse. They are transmitted through sex. There are many of them. Some of them are curable, meaning you will get treatment and you will be fine. Some of them are not curable. That means there's no cure. If you get it, you will always have it. So what I will do is I will first let me check something. Actually, how you get them is, I'm not being specific, is when you have sex without a condom. If you have sex without a condom, you will get STIs. Because they are not written on the person's forehead, you will not know. It's not, for instance, there is that term that people like to say, they like to use patients. They usually say that, no, sister, he is clean or she is clean. There's no such thing as being clean when it comes to STIs. Unless you have tested. Okay? Unless you have tested. I will tell you about my website that I'm busy preparing that will sell all STI tests. So if you use a condom or you use PrEP against HIV, PrEP is against HIV, and I have heard, I am not sure, I have come across also a prophylaxis called DoxyPrep, Doxy PEP. If you know about it, please let me know in the comment so that other people can know. So when I saw about this DoxyPrep, it was someone who had actually had intercourse. It was oral intercourse with a few people, and they were advising the person to use DoxyPrep. And I was wondering, what is DoxyPrep? But I think it's doxycycline though. But I've never really heard about it. So today I'm only covering 2, but there is many. I will cover the rest. The next ones that I will cover is syphilis, herpes, maybe syphilis. No, syphilis is very complicated. I will do syphilis alone. Maybe I will do herpes and HPV together. So today I'm going to do gonorrhea and chlamydia. Okay, those are causative organisms, or those, I think they are both bacteria. Yes, because we give antibiotic. Those are the bacterias that cause the infections I'm going to talk about. Gonorrhea or chlamydia. There is a test for gonorrhea. There is a test for chlamydia. As I told you, I will tell you at the end about my website that I'm busy with, that is going to sell the tests so that you can know before you indulge. Before you indulge, you first know. You first do the test. Do the test together. And then you know who's what and who has what. Okay. And then also when it comes to who has what, you need to understand that actually before you do the tests, you must talk to each other and tell each other that regardless of the result, this is what's gonna happen. If I test and gonorrhea is positive and you are negative, this is what we're gonna do. Remember, gonorrhea is treatable. If I test and HIV is positive, this is what we're gonna do. So you need to first have a talk before you do the tests. So when it comes to gonorrhea and chlamydia, there are STI symptoms that it causes, or there are STIs that it causes. So for females, it causes vaginal discharge syndrome. For males, it causes penile drop or e-drop ngesixhosa bathi phova nanoba liyesixhosa naphathi kuthiwa i-drop yenza i-drop. And then in females, it also causes lower abdominal pain, amazantsi esinqa abuhlungu. So what I'm going to do is I'm going to start from the VDS, which is the vaginal discharge syndrome. The vaginal discharge syndrome is when you, as a female now, your vagina starts to itch and it's very itchy and your discharge changes. A woman's normal discharge is white. It is a bit fluidish. It's not like feta cheese or whatever. No, it is fluidish. It doesn't smell. That's the normal one. We don't even know it's there. It's actually normal for ladies to have a discharge because our vagina needs to be lubricated. So but when you have an infection, when you have a vaginal discharge syndrome, that discharge will not be normal. It will be smelly, it will change color, yellowish, reddish, it might be a lot of it. That's the vaginal discharge syndrome. The penile drop. Okay, no, let me first finish with women. Lower abdominal pain. With lower abdominal pain, you will have a pain that is below your navel. That is in your pubic area. It just doesn't go away. It's just there. And you are sexually active. So that is lower abdominal pain. We give you treatment. Now, for males, you get a drop, penile, what was I going to say now? Urethritis. We actually call it urethritis. It's called MUS, male urethritis syndrome. It starts gradually. Okay. It starts gradually. It can first start with an itch. You can maybe feel that your penis is a bit itchy, and then it will move to a discharge, maybe a yellowish pussy discharge or a watery discharge. Remember, you should not be having discharge there unless you are ejaculating. There shouldn't be discharge coming out of the penis. And then so it starts with the itch and then the discharge, and then for some people they will say it's painful. Their penis is painful. Some people will also end up with having another STI that usually likes to accompany drop or MUS or urethritis, which is called bubo. Their groins will swell. Bazabana lento ngathi kuthiwa imlapho. Ube nemlapho, ube namaqhuma apha kule ndawo apha emaqaleni. So it usually likes to accompany urethritis. Usually it happens if you've had urethritis for a long time. That is why when you start having STI symptoms, go to the clinic as soon as possible. Go to the clinic as soon as possible. I am saying go to the clinic. I know why. I know why. I don't want to diss anyone. I don't want to diss any healthcare provider, but I'm saying go to the clinic. Either a municipality clinic or a government clinic. Just go to the clinic, okay? Now, the other thing that is important that I haven't mentioned is that you must be very careful, because there are people who do not have symptoms of an STI, but they are carriers. We call them asymptomatic carriers. You will sleep with them. You were both fine before. You will sleep with them. And after that, after a few days, 2 days or 3 days or 4 days or 7 days, it doesn't matter the incubation period. It depends on the organism. You start having symptoms. And then when you then go to the clinic for treatment, you are then given a partner slip for them to be treated as well. And then they tell you then, but I'm fine, but I don't have an STI. You see, that's a problem. That is why it's important to test, okay? Now, in the government clinics and in the municipality clinics, they don't test for other STIs. They only test for syphilis and HIV, okay? That is why it's important to, in my website, actually, you will even have combos. It will like have 5 STIs. Herpes, gonorrhea, chlamydia, trichomonalis, HIV. You can buy all of them for both of you and your partner, or your partners. Buy for all of y'all, and then you do the tests. Then you know what's going on. But when you do the test, you must remember that there is a window period for diseases. You must ask each other, when last did you sleep with someone else? Okay? And there are different window periods for different diseases. Okay? So that is basically it about gonorrhea and chlamydia. It causes VDS, which is vaginal discharge syndrome, which we treat with ceftriaxone, azithromycin, and flagyl. And this is in women. And then you get lower abdominal pain, which we also treat with the same things, but then the flagyl is longer. The course of the flagyl is longer. It's 7 days. And you have urethritis in men, eat drop. We also treat you with the same things. So the next video that I will do on STIs, it will be about syphilis. Syphilis is another dangerous one, because most people, it doesn't have symptoms. It's another dangerous one. I know of a case of a mother who miscarried because of syphilis. So it's a very dangerous infection. So I will talk about syphilis on the next video. So look out for my website, guys. I am busy with the website. It's going to sell a lot of things, health things, especially the things that I talk about. But mainly it will be an STI test online store. I want people to know their statuses: gonorrhea, chlamydia, herpes, hepatitis B, hepatitis I think it's C or A. I don't remember which one now we have. And HIV and all of that. So we're gonna add more. Even for females, we're gonna add more. Yeah. So look out for the website, but I will tell you when the website is up and it's running. But it's on the way. It should be on TikTok and Instagram. We are busy with our Instagram page. We're still creating content for the Instagram page, but when the website is up, I will put it up on the Instagram page as well. We are also busy with the website as well, guys. We're busy with a lot of things. Okay, it's very busy. We are busy with a lot of things, but all things work together for our good anyway. So that's it, guys. Next time, see you next time. Please ask questions, guys. Please ask questions. You are very quiet in the comment section. You are very loud in the inboxes. Please ask questions, because when you ask questions publicly, some other people can learn as well. But I also understand why you also prefer to go to the inboxes, because some questions are very private. All right, from me, Sister Yonela, all the best, all the best. I love you. Take care.